Greetings, care workers, caregivers, and carers. They've been significant, valuable, and essential way before COVID-19. They're essential now, during COVID-19, and will be after COVID-19. Data have shown for the past 2 years, home care work is the fastest growing occupation in the world. As more and more people age, they want to remain in their homes versus going into a care facility, meaning nursing home, Alzheimer's care facilities, etc. I like to say, and I'm biased, that caregiving is the most important job in the world that no one wants, not Google, Microsoft, or Twitter. So let's turn caregiving into a better job, benefiting the caregiver first and those they're going to care for, because we're going to need them more and more. We already depend on them more and more, as have become so evident during this pandemic. Care workers and caregivers, they play an irreplaceable role within the greater healthcare systems. But we have continued to undervalue, underappreciate, and sometimes stigmatize them under the umbrella of low-wage workers, low-skilled workers. If you follow the Global Caregiver Program, you're going to become so knowledgeable about who care workers are, how skilled these individuals are, and that this is not a job for everyone. I am Beverly. I'm a caregiver veteran across 2 continents. Currently, a private care manager in the San Francisco Bay Area who have trained and educated caregivers for the greater part of 2 decades, and like I said, 2 continents. They are a force to be reckoned with. Everyone cannot do this job. So I am urging communities, governments, care consortiums globally to change the way we see, the way we view and recognize the important and profound contributions the care workers make. Sooner or later, we're going to need them. During the seemingly cruel lockdown during the pandemic, I know you've all read an article here or there across social media where seniors and the frail elderly were denied visits and hugs from their loved ones, and many died alone and afraid. Newsflash, the care worker, the caregivers were the ones who held their hands. I can't imagine how they did this with the social distancing. But they were there holding hands and reassuring them. It didn't take a pandemic to know that isolation and loneliness kills, just like COVID-19. It kills in young adults and children. Just imagine the elderly, those who gave birth to us, nurtured us hopefully, and look up to us to care for them when they could no longer care for themselves. This conversation could go on and on and on. As you can see, I'm very passionate about this conversation. In my next video, I'll attempt to narrow down to you the many titles and educational backgrounds care workers come under, because many people are sometimes confused depending on the state, the country, or the vicinity that you work and live. I will tell you now, in the US particularly, many health workers and caregivers are immigrants. They're disproportionately women, people of color, middle and poor Americans across the ethnic spectrum. And this may highlight the underinvestment and lack of benefits we've provided for them, which I now know poses an even greater risk to their lives during this pandemic. Despite them being so undervalued, marginalized, sometimes termed low-wage workers, they make up 78% of the healthcare support industry, usually plagued by long hours, extremely low wages, difficult working conditions. They continue to make profound contributions to the greater healthcare industry. And it is time for us to stand up for healthcare workers in home care, workers, caregivings, whatever term you feel comfortable using, because without their dedication and commitment, there would be no care. I'll summarize this by saying that when caregivers and care workers feel supported and valued, they'll continue to deliver superior care. Caregivers are the world's most precious assets, not commodities. Let's care for them now as they go out to care for our elderly citizens, those with disabilities, children and adults, and Americans across the board dealing daily with medical challenges. I believe when we put carers and caregivers first, it's a win-win all around. I'm Beverly. Join me at The Global Caregiver on Facebook and YouTube. You may message me on Messenger and at theglobalcaregiver@gmail.com. I can't wait to hear you.